Assalamualaikum and a very good day to our beloved viewers. We are back with our series on COVID-19 and engineering. My name is Adam Al-Bakri and I will be the presenter for this session. In today's video, we will look into the topic of Parliament and COVID-19. As you are aware, COVID-19 is real, Delta variant is real, and Lambda variant is coming. In other countries, like in the US or in UK, new infections are on the rise due to this new variant. And states who are anti-vaccine are seeing increase on COVID-19 patients as reported by the US news. Despite the vaccination efforts, we have to live with the virus in the near future. Here are some comparisons between Malaysia and Japan. The vaccination rate between Malaysia and Japan are almost similar. As for Malaysia, it is about 49.81% and Japan is only about 47.86%. Despite having more people vaccinated, Malaysia's death rate is 68 times more than Japan. Even on daily cases data, it shows that we are currently experiencing 5 times more compared to Japan. This is worrisome. We need to acknowledge something is wrong here. New normals does not only limited to social distancing, wearing face masks, and maintaining good hygiene. The entire ecosystem where we live and work requires rethinking, particularly the air that we breathe in the workplace and at home. Engineers and building owners need to rethink on how to ensure our buildings will not become an agent of transmission for COVID-19. The outbreak at Parliament could be due to lack of mitigating measures apart from existing administrative controls being instituted. The virus that causes COVID-19 can spread by exposure to droplets and aerosols of respiratory fluids that are released by infected persons when they cough, sing, talk, or exhale. Obviously, the air inside Parliament must be engineered so that the contaminated aerosols could be minimized. So by reducing the accumulation of air particles, we actually reduces the chance of infections. Here are some administrative SOPs that me, as an observer, notice during the parliamentary session. There are being practices with the use of face masks, physical barriers, temperature management, which in actual fact is not very effective for asymptomatic cases, by the way, and sterilization are being practiced religiously in Parliament. But what about engineering controls? Many studies have shown that these controls can reduce the infection's probability. There are 7 engineering controls, the main ones, that can be initiated. The first one is temperature and humidity control. Optimum humidity between 40 and 60% relative humidity can reduce the half-life decay of viruses. Studies have shown that less than 1% of the virus survive after 2 days at these conditions. If this existing air conditioning system is incapable of achieving such humidity, then a dehumidifier should be considered. Next, increased ventilation rate based on demand. Create a dilution effect which reduces high concentration of pathogens in the air, therefore decreases the chance of infection. Number 3, we have installation of HEPA or MERV 13 air filters at air handlers. This is to eliminate the aerosols from the airstream. Ventilation system can be supplemented with portable high efficiency particulate cleaners, air cleaners, to reduce the number of infectious particles in the air and provide enhanced protection from transmission between persons. Next, we have installation of ultraviolet germicidal or UVGI light in the air handler or wall mounted inside the Parliament building, exposing microorganisms to ultraviolet radiation in the range of 200 to 280 nanometers, also known as ultraviolet C-band, UVC light or UVC band, will alter the DNA of the virus and it will render it less effective. Next, consider flushing of air before and after use of parliament. It can be used to ensure that still contaminated air is exhausted from the building before and after use. Next, we have zoning of spaces. Discrimination of spaces between sensitive and less sensitive areas can prevent tenants or workers from intermingling. And last but not least, air conditioning system controls appraisal. It is to check whether this has been assessed and all sensors and controls are operating properly. We need to understand the agent of transmission is air. Therefore, treat the air in order to have an effective mitigation of infections. With that, we would like to thank our viewers for listening. We hope you gain a valuable insight and knowledge from this sharing session. Don't forget to hit the like button below and subscribe to our channel for more interesting videos. Stay safe, kita jaga kita. Thank you.